The terms burnout and compassion fatigue frequently describe the overwhelming exhaustion and related symptoms experienced by those in the healthcare industry. However, those terms may incorrectly create the appearance that a healthcare employee is not strong enough to handle their workload demands. As a result, they may be hesitant to step forward to receive the help they need. Physicians and other clinicians are highly motivated, educated, bright individuals, well equipped to solve most issues. Additionally, they are accustomed to working hard in school, training, and their clinical practice. Burnout may be an early indicator of something more ominous than simply overworked. Physicians and healthcare workers work with a constant tension between serving their patients, their organization, and their own ethical and moral beliefs. The effects of this frustration are magnified with the naturally resilient and self-reliant attitudes of many healthcare workers. In many circumstances, a more appropriate term would be moral injury. Moral injury has been described as the inability to deliver quality care and desired results due to circumstances beyond the clinician's control. Forced increases in workload, apparent schedules, insufficient staffing, inefficient policies and protocols, and lack of resources have contributed to this difficult tension. Most clinicians consider healthcare to be their calling, which only serves to exacerbate issues when non-patient care requirements crowd out their day. These can include electronic health records, computer systems, non-value-added documentation required for billing purposes, an endless series of inappropriate EHR-generated alerts and reminders. Combined, these issues are putting the physical and mental well-being of these frontline workers at risk every day. Throw in COVID-19 and the intense stress of an ongoing pandemic with mass casualties, inadequate PPE, and highly vocal skeptics questioning the reality of the disease, and it is easy to see how pressures can create an unhealthy work environment. What causes and contributes to moral injury is still being researched. However, there have been correlations between symptoms of moral injury and a healthcare worker's exposure to events that involve perpetrating, witnessing, learning of, and or failing to prevent acts that contradict their own ethical or moral beliefs. Individuals exposed to these types of events may begin to display psychiatric symptoms, suicidal ideations or attempts, and an array of other issues such as guilt, anger, isolation, shame, depression, anhedonia, sensitivity to pain, difficulties doing physical tasks, marital struggles, religious cynicism, and depending on the event, disapproval from family and friends. The pandemic added additional sources of anxiety, like the fear of bringing the disease home to loved ones, lack of PPE or testing, fear their loved ones would have no one to care for them should they fall sick, lack of child care access, being sent to new and needy communities, and a general lack of information coupled with poor communication. As we near the end of the pandemic, some of these pressures are easing. However, many will remain for a long time to come. Individuals who have been exposed to these events will need assistance and care as they navigate their recovery process. For more information, contact Relia Healthcare today.